Welcome to this introduction to the low FODMAP diet for IBS. We are a team of gastrointestinal healthcare professionals with expertise in IBS and the low FODMAP diet. Program Overview. Objectives. Understand how a low FODMAP diet might alleviate some symptoms of IBS. Identify ingredients and recipes that are low FODMAP. Learn strategies for following a low FODMAP diet. Gain confidence in the selection and preparation of low FODMAP foods for IBS. What is irritable bowel syndrome, IBS? IBS symptoms: diarrhea, constipation, abdominal pain, flatulence, bloating. Prevalence of IBS is 10 to 20% globally, higher in women and people less than 50. Onset is often preceded by anxiety and depression or an adverse life event. The main features of IBS include visceral hypersensitivity, altered motility, altered gut microbiome, enhanced communication of the gut-brain axis. What causes IBS? Hypotheses include SIBO, small intestinal bacterial overgrowth, chronic intestinal inflammation. Visceral hypersensitivity. Current treatments for IBS are drugs, medications, probiotics, and diet. Common dietary approaches for IBS are: consume more soluble fiber, eat small meals throughout the day, limit caffeine, limit alcohol, limit high-fat foods, limit spicy foods. What does FODMAP stand for? Fermentable, oligosaccharides, disaccharides, monosaccharides, and polyols. What happens when we eat FODMAPs? When we eat, food passes from the mouth down the esophagus to the stomach. In the stomach, food is mixed and broken down before being slowly released into the small intestine. Enzymes in the small intestine continue to break food down to single molecules so that it can be absorbed from the small intestine into the bloodstream. Any part of food that isn't broken down or absorbed will continue its path along the digestive tract and pass into the large intestine, or colon, for elimination. There are two processes that can occur during this progression that may trigger symptoms in certain people, including: first, certain FODMAPs are highly osmotic and readily draw water into the small and large intestine. This can affect how fast the bowel moves, and cause diarrhea. Secondly, when FODMAPs reach the large intestine, they are fermented by the bacteria that naturally live there, and just like when beer is fermented, this process creates gas and bubbles. For sensitive individuals, this results in abdominal distension, bloating and cramping. The low FODMAP diet reduces pain, bloating, and diarrhea for many patients with IBS-D and visceral hypersensitivity. Greater compliance to diet results in greater symptom reduction. Current evidence makes a strong argument for the short-term efficacy and safety of a low FODMAP diet for IBS patients when supervised by a credentialed healthcare professional. Oligosaccharides are found in vegetables, fruits, grains, nuts and beans. Disaccharides are found in dairy products. Monosaccharides are found in vegetables, fruit, sweeteners and alcohol. Polyols are found in vegetables, fruit and sweeteners. High FODMAP diet checklist of oligosaccharides, disaccharides, monosaccharides and polyols. Low FODMAP serving sizes for some foods. Any significant change to diet should be done under the supervision and guidance of a credentialed healthcare professional. Elimination of all high FODMAP foods for 2 to 6 weeks, followed by reintroduction by FODMAP category. A strict low FODMAP diet is not necessarily a long-term diet. In order to create a sustainable solution, foods that can be well tolerated should be added back into the diet. Challenges with a low FODMAP diet: restrictive diet, inconsistent resources, common high FODMAP food products, costs, cooking skills, quality of life. We have free resources to guide you on the low FODMAP diet and IBS. Strategies for the low FODMAP diet. Seek help from a credentialed healthcare professional. Cook more. Download the Monash University FODMAP app. Take time to meal plan. Enjoy a variety of low FODMAP foods. Limitations. Potential hazards: inadequate intake, complicated relationship with food. Work with low FODMAP and GI experts to navigate the diet successfully. Bottom line, there is no one diet that will work for every person with IBS. Evaluation. Identify one way a low FODMAP diet may alleviate some symptoms of IBS. Name 3 low FODMAP foods. Identify 2 strategies for following a low FODMAP diet. Set SMART goals to navigate the low FODMAP diet successfully. SMART goals are measurable, attainable, relevant, time-bound and specific. Our resources include low FODMAP foods, protein powders and supplements for IBS. Free low FODMAP recipes and meal plans. Free low FODMAP video courses. Free books and apps to navigate the low FODMAP diet. IBS care programs with low FODMAP and GI experts. All the providers in our IBS care programs are gut experts and experienced in the low FODMAP diet. Programs include the Dietitian Care Plan. This is a personalized IBS care plan with medical and lifestyle therapies from registered dietitians, RDs, and health coaches. This plan can be modified as your needs change. With this plan you get monthly visits with your GI RD and health coach, evidence-based therapies and text messaging. Nutrition, sleep, mindfulness and stress management. Holistic and lifestyle changes. Educational resources. We also have an integrated care plan. This is a comprehensive IBS care plan of medical and lifestyle therapies from an integrated care team of GI clinicians, registered dietitians, RDs, and health coaches. This plan is personalized and can be modified as your needs change. With this plan you get monthly visits with a GI clinician, labs and evidence-based therapies including prescription medications if appropriate, monthly visits with your RD and health coach and text messaging. You also get nutrition, sleep, mindfulness and stress management, holistic and lifestyle changes and prescription management. If you don't want a package you can also book single sessions with a GI clinician, a registered dietitian or health coach. Good luck with the low FODMAP diet. Reach out to us via email with any questions. Follow us on social media for the latest information and education on the low FODMAP diet, IBS and gut health.